Hello, Michigan Medicine, and welcome to the latest episode of The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication. Today, we're going to figuratively hit the road and head west to Chelsea to discuss a new program the organization has launched thanks to its joint venture at St. Joseph Mercy Chelsea Hospital. Before we get into that, be sure to get caught up on any episode of The Wrap you may have missed. Episodes launch every week and can be found on YouTube, iTunes, Stitcher, Google Play, or any other podcast hosting platform. You can also find the show each Friday as part of the Headlines Week in Review. Now, earlier this month, Michigan Medicine debuted the Michigan Hospitalist Service Chelsea, which allows for the organization's physicians to see inpatients at St. Joseph Mercy Hospital in Chelsea, which is located in western Washtenaw County. To discuss this new program, we're joined by its medical director, Dr. David Bozan. Dr. Bozan, thank you so much for being here.
Thank you, Daniel. Thanks for having me.
Now, first, can you briefly explain Michigan Medicine's joint venture with St. Joseph Mercy Chelsea and what it means?
Yeah, absolutely. So Michigan Medicine entered a joint venture with St. Joe at Chelsea Hospital back in 2018. Chelsea Hospital was providing excellent care for the residents in the greater Chelsea community, and Michigan Medicine, St. Joe partnered in this joint venture in order to share best practices and innovate care delivery in a way in which the partnership could continue to define care into the future.
Excellent. Now, what exactly is the Michigan Hospitalist Chelsea service and how does it work?
Yeah, so the Michigan Hospitalist Chelsea service is a team of doctors that care for patients when they're admitted to the hospital. This team of doctors sees patients at the University Hospital and is expanding now to offer 24/7 care for patients when they're admitted to Chelsea Hospital as well. We will be seeing patients who present to Chelsea Emergency Department if they have a Michigan Medicine primary care physician, or we will be transferring patients from Michigan Medicine Emergency Department to Chelsea Hospital and care for them if it's determined that that's the right place for the right patient at the right time.
Yeah, I think that's so important. And one aspect of the service that I find interesting that I think maybe not all of our employees will understand is even just the term hospitalist. Can you quickly explain sort of what it's such a generic term, right, for a type of physician? Can you explain what a hospitalist is and the work that they perform?
Absolutely. So hospitalists are medicine physicians who focus their practice on caring for patients when they're sick and need to be admitted to the hospital. We work closely with all the different services in the hospital and optimize and innovate processes to continue to provide the highest quality of care to the patients that are admitted.
All right. So now getting back to this specific service in Chelsea, why is that service so important, both to Chelsea Hospital and to Michigan Medicine in general?
Yeah. So this service is established to allow the medical services to grow in Chelsea Hospital. Right now, at Michigan Medicine, we have high capacity issues, or there's too many patients to see, and oftentimes patients need to wait for a hospital bed. A hospital medicine service with hospital medicine physicians in Chelsea will allow for these patients to be admitted quickly into the hospital and offered the highest quality of care for our patients by our Michigan Medicine doctors.
Yeah. And I think one thing interesting, we spoke about this a little bit last week, is, you brought up the capacity issues at University Hospital and also looking at the historic trends at Chelsea, right? But they weren't necessarily filling all of their beds to capacity. So it sort of optimizes care in both locations, right?
Absolutely. And additionally, this joint venture has really led to increased surgical capabilities in Chelsea Hospital with the build of additional operating rooms and more of our Michigan Medicine surgical colleagues to care for patients and operate on patients in Chelsea Hospital. The medical complexities of some of the patients limit who can be treated surgically in Chelsea if they need to stay in the hospital. And we will be offering consultative services to our surgical colleagues for patients in Chelsea to allow optimization of the surgical rooms and capacities at Chelsea.
Excellent. Now, what is the number one takeaway you would want employees to know about this new program?
So I think the number one takeaway is that we are now in Chelsea Hospital, and we have a service that is ready to see patients, and patients can come to the service either through the emergency department at Chelsea Hospital directly or from Michigan Medicine. But we are a group of highly trained physicians that work as a team, and we have launched our service in Chelsea already.
Yeah. And I think that's the important thing is this is a group of Michigan Medicine physicians, right? It's the exact same physicians who you could see at University Hospital who you are now seeing at a totally different location.
Yeah, that's right, Daniel. It's a group of physicians who still are going to be working in the University Hospital. We have a large group of hospital medicine docs, and asked the pool once we announced that we're going to be starting this hospital medicine service in Chelsea, who wants to have part of their practice in the fantastic community of Chelsea. And we had a number of docs very interested in spending a few months a year in Chelsea. And so all of the docs are going to be kind of both hybrid Michigan Medicine Chelsea docs.
Yeah, that's great. Now, how big is the program to get started? And I know it just launched this month. And where do you see it sort of going from here and well into the future?
Yeah, great question. So our program is looking to have 12 patients on average, plus providing consults for our surgical colleagues. We've expedited the launch of this program in the era of COVID to have more capability to see patients if there is another surge. So this program really gives us the ability to move more patients from Michigan Medicine over to Chelsea and act as a relief valve if the hospital system becomes full. In the future, we expect to add patients from the cardiology clinics and general medicine clinics who have heart failure, and we are working closely with our cardiology colleagues to really innovate heart failure treatment and focus on not just treatment when patients are in the hospital, but also the 30 days after discharge with some innovative processes to really redefine that 30 days after discharge with more education, more access to virtual care after discharge, and interventions really optimizing medications. Then in the fall, we're looking to add patients who need chemotherapy for blood cancers, lymphoma and leukemia, and directly admit patients from our hematology clinics and provide them with their scheduled consolidated chemotherapy treatments.
I think that's sort of one of the coolest things. They mentioned all this innovative care and innovative services that you're going to be launching is that I think that this program won't just benefit the patients that are being seen in Chelsea, right? Like the best practices that you guys learn can then be launched organization wide and help hundreds or even thousands of patients.
Yeah, absolutely. That's always our goal at Michigan Medicine is to really learn from our innovations and really learn from these opportunities to really reach best practices and then share those best practices to our community in Michigan Medicine and beyond.
Yeah, well, that's fantastic. Thank you so much, Dr. Bozan, for sharing this information. If you want to learn more about MHC, be sure to visit mmheadlines.org. That's mmheadlines.org. While you're there, you'll find other important stories from this week. For instance, the organization gave readers an inside look at its new laundry cooperative in Detroit, and faculty and staff were recognized for making a difference in May. Find those stories and much, much more at mmheadlines.org. All right, it's time for the weekly trivia contest. Last week, we asked listeners, Juneteenth celebrates which event in American history? The answer is the end of slavery. Congratulations to Deanna Norris, who sent in the correct answer. Deanna, a member of the Department of Communication, will be in touch shortly to help you claim your prize. Now for this week's question. When was the first patient admitted as part of the Michigan Hospitalist service in Chelsea? Once again, when was the first patient admitted as part of the Michigan Hospitalist service in Chelsea? You can find the answer in this week's headline story, and once you know it, send it to headlines@med.umich.edu for the chance to win a prize. That's all we have for this week. Thank you so much, Dr. Bozan, for being here. And as always, thank you to all of our listeners for everything you do for patients, families, and each other. We'll see you next week.